Just, we're going to roll through quite a few slides of what you need to see when your patient is being examined. I suggest have them bring a full mouth x-ray. It'll help you so much in determining how you're going to handle that patient. Number one, you got to look in the oral cavity, which most health professionals don't do who have an MD license. I don't know, they don't think that belongs to the rest of the body. Using EDS is a great tool for pre and post-surgical evaluation. In other words, you can locate your infection in the jawbone within 2 millimeters of the site that needs to be cleaned out or operated on. Bimetal currents, that's another instrument that I had developed by electrical engineer to measure the, what do I hit here? Just the space? Space here? Okay, good. Okay, these are the full mouth x-rays that you will be looking at and evaluating for that patient. You can't see anything wrong with this mouth except everything. All the metals in there are a heavy burden to the immune system. 21 case study showed that after removing the metals, within 3 months the immune system doubled. So that was a big help to that patient. We're looking at, I can't find, here it is. We're looking at this up here. This is a root canal treated tooth. We have another one down here. The meridians that affects is the large intestine and the lung. And in the front of the mouth, we're looking at other organ systems. Where to go? Here. That can be affected, especially the rectum and anal canal, urinary bladder, kidney function. Go ahead. Okay. I'm going to run through a few of these. Can you pick out the root canals? And then you can pick out the, here's the heart, small intestine, lung and large intestine, a liver, gallbladder, anterior portion of the mouth, along with all the metals, one sick person. Here we go again. Root canals are a common thing. All root canals are infected, and the way I explain it to the patient is, if you ever pulled a weed out of the garden, you see the main taproot, you see all the little auxiliary roots that are fed into the taproot. If you could take the nerve out of a tooth in its entirety, that's what it would look like. And so you cannot fill all these little auxiliary canals, which they claim they can hit with a laser or a light that can clean it all up. That's not true. You can see here this lady had tiredness, hands tremble, mouth lacking energy, compatible fillings, removed cavitations. He felt an increase in injury, hands, and claimed calm down. This is Pat with fatigue, mouth pain. She was trying to lose weight. She's probably about 250 pounds overweight. And she's down about 60 pounds, feels so much better. But we wound up putting in an upper denture. All these teeth had to come out because of their involvement with infection. Pain and decay in this guy's mouth. And we used the Holestor. Holestor is a composite that contains no aluminum oxide, no iron oxide, no fluoride, and no barium. It's made by Denmat. It's not a strong material, so we use it in low stress areas. The other product is Premise Indirect Neutral. Has no coloring in it and no metals. It's a laboratory-made restoration. This lady wondered why she didn't feel too well. These are blade implants. Implants that they started years ago, and most of them fell out of the mouth. This is an interesting thing that you want to watch. See this little white line right here? That's a bonding material that contains barium. Energetically, very devastating to the patient, but it looks like it's kind of not a problem. This is a normal looking tooth. This is the results of the tooth that I looked at. Little point here shows the abscess. The result of this, where are we here? Where the arrow is pointing is a calcification of the nerve canal. So it couldn't get supplied with the good nutrients, so as a result here's a little infection showing the abscess developing in that tooth. This is a lady from Russia that we had a chance to look at. All of these teeth are root canaled. That's what they do. I'm losing my pointer here. Up, up. Anyway, all of these teeth are attached in one casting where they bonded them right to the teeth. The attachments are called precision attachments. You can see the little tab on the end there, right here. And that was with a metal partial. She wondered why she had a headache. I'd give anybody a headache. X-rays will show the metals and metal oxide containing restorations. X-rays will not show the fluoride, however, CDS will. X-rays will not always show infection from root canal treated teeth. CEDS does. X-rays will not show the vitality of a tooth. CEDS does. So it's, yeah, computerized electrodermal screening. Okay. This is a case where removal of a wisdom tooth. This is the tooth. It was completely inverted. In other words, the occlusal portion of the tooth was pointed downward. This is the tooth. I think the tooth bud didn't rotate right, where the roots were pointing up instead of growing down. Just an anomaly. Here's David's full mouth x-ray. He came in with fatigue and wondered why he was not feeling well. This is an implant and root canals and metal in his teeth. This is the letter he wrote to me. He said how sick he was before he came to my office and how much better he felt after he got all his bad teeth out and the metals out. His brother-in-law was in and he says, Dave's back. So he really felt good. This is the right and left side of the mouth. With these are the, this is the side where I removed all the restorations and found the teeth to be broken down and decayed. This is the other side that we took out. This is the lady that came in to me and is hopefully going to get down to see Dr. Yu. She has the start of scleroderma. At 17 years old, her father kicked in the money to have her get these implants in where she was missing some teeth. These implants are in the sinus. This is the looking at her mouth, and from the right side, this is the way we take those out. We retract the tissue and then remove the bone over the implant. And this is the removal of the implants on the right side. We did the same thing for the left side. These are the 6 implants that were put in there. One of the implants wasn't even functional. It's just, I don't know what he just put it in there. We took it out and cut off the teeth, made a treatment partial and put that in. Outcome, removal of implants, increased energy. She could close her hand about 95% better, but I don't think it's going to take care of the scleroderma. This is with digestive issues, and we replaced the fillings that she had in her mouth with the good materials. This is two of the laterals that I took out. One had a root canal and one did not. I haven't figured out, and I hope you might volunteer the information. Why the black roots? The only thing I can think of is that the iron in the blood shows up after it's been in the air. And this is another one of Dave's depression that you saw his mouth where he had implants up here. And that was the thing that pushed him over the edge. All implants seem to be not compatible.
Particular bacterial stain them, won't they? In general?
Energy.
I said a particular bacterial stain your teeth. In general, just maybe they were living down there?
I don't know, we have another mutual patient that we haven't figured it out. So this is going into, after we removed this, his energy level increased and depression was gone. Gold causes depression, only when it's in your pocket it doesn't. This is what we restore missing teeth with, and it's cured at 167 degrees or thereabouts for 24 hours. This pink does not contain cadmium. Most pink does, and it produces an energy effect on the patient. These are unilaterals, very simple replacements of a single tooth. This is a 42 came and decayed teeth extracted, one root canal, and one has a root canal, one doesn't. You can tell here by the color in the tooth. That's the iron in the blood seeps out into the dental tubules and the cementum. This is what we use to locate our cavitations with and check post-surgically with. Cancel energy of the metals, we can do that and find the right materials, compatible materials to restore the tooth and the edentulous areas that you want to be able to check. Recheck possible cavitations after the fillings are removed. Remember I mentioned it, that sometimes the filling makes the area look like it has infection in it or a cavitation. So be aware of that. This is the way we stimulate the area to detect where the cavitation is. You can actually find the cavitation within 2 millimeters of where it's located in the jaw. So it's a very exact way of doing it. Don came to my office having cavitation in 32. He came in and started that he could not reach his right arm across his chest. After completing the cavitation, he could immediately reach right arm across his body. Reminds you of the other patient who couldn't raise his arm till you froze the area with anesthetic. This is the way we do our cavitations and take out a biopsy. We got her up here. The upper left-hand one is cutting a bone and taking that out and sending it into the pathologist. But you can see how large the cavitation became as we remove the infection. This is another one of the cavitation. We use a small burr to cut the area and then pick out the bone, send it into a pathology department in Texas. Infection was found within 2 millimeters. Like I said, there, his bone is clean with a number 8 round burr. We flush the area, and of course it's difficult to get some real good pictures, but the CDS balance back to 50. Here we are cutting a small portion out, using a curette and picking the bone out of that area to send it in for a biopsy. These are pretty much academic. This is the size of the biopsy. It's not very big, but it usually comes back ischemic bone. There we are, another cavitation of cutting the area open. This is the little biopsy bone that we get out of there and can send it in for evaluation. This is an unusual picture here. It's a mutual friend of Simon and myself. But notice the green bone. I think it's a bacterial condition that causes that. But as I open the left-hand picture here, and then we went just a little deeper and found that. So if we hadn't used electrodermal screening to detect it, we hadn't quite cleaned out the area, that would have gone as a problem to that area, thinking we had cleaned it when we really didn't. This is the number 2 that's on the upper jaw. Cavitation, usually it can pierce right through the bone. It's like an eggshell. This is an extraction of a wisdom tooth. And of course, with the metal filling, chances are that area is going to have to go back and clean it out once we get the metal out of the teeth. I put this a good tooth on the EDS, and it shows up at 50. Checking possible surgical sites for infection, stimulation of each site, rechecking after surgery with CDS, and then I recheck in about 6 to 8 weeks to make sure that we've cleaned up the area. This is the oral potentiometer, which reads out in millivolts, microamps, and microwatts times seconds. You see the gold filling and then the mercury fillings on each side, so it winds up to be a bimetal current. For every microamp, and I'll tell it to you, but I don't tell it to my patients, for every microamp, there's a certain number of ions that leave that filling. It's 3 times 10 to the 12th power ions per second come off of that filling. One of the reasons why we have cavitations, here's checking the teeth as we go across from back to the front. Each one has a little different reading. When we added those all up, we had a huge amount of current in there. This is the way we do that. We add up the voltage and the amperage, and that's what they were putting up with in the mouth, causing health problems. This is a composite filling that was taken out where the dentist left the mercury filling underneath. This is a all metal crown, and we cut that off, and underneath it is silver mercury filling. This is one we cut off here and then took it off the tooth. This is what was left under there. The dentist is saving time and money. His money he's talking about, not the patient. This is my office. This is in 4 seasons. My summer, my fall, winter. So somebody's got to live there. It's on a trout stream where the trout stream makes a half-mile bend around, and you can get in on one side, fish for an hour and a half, and get out on the other side, hopefully get a few fish. This is the book I put together, rescued by my dentist. We can do it all together. Thank you, Dr. Yu, for having this conference.
Yeah.